U.S. President Donald Trump has returned to hospital after leaving it briefly in a motorcade to wave to a crowd of his supporters gathered outside. Now, this surprise move appeared designed to signal that his health is improving after he was hospitalized Friday for COVID. Earlier, Donald Trump posted a video from the presidential suite at the Walter Reed Medical Center, where he's being treated right now.
So it's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it. And it's a very interesting thing, and I'm going to be letting you know about it.
Let's find out more now. We're joined from San Francisco by Professor Peter Chin Hong. He's an infectious disease specialist and an MD at the University of California there. Professor, thanks so much for coming in today on this. You've written an assessment saying the president is at an elevated level of risk. Can you tell us why that's the case?
Well, thanks for having me on, Brian. He has three elements that make me a priori think of him as high risk. He's a man, he's 74 years old, and he is slightly obese. That by itself puts him at elevated risk. The other factors are even more concerning, which are the fact that he has fevers, he has oxygen requirements, and he has a cough. So putting everything together, I would put his mortality risk at 15 to 25%, based on the data we have from previous studies.
Okay, that certainly is a concerning assessment. We also know that his oxygen levels dropped twice. What does that tell us about his condition?
It tells us that he is veering on the inflammatory phase of the disease. There are two phases of COVID. There's the infectious phase when the virus is reproducing and making virus children, so to speak. Then there's the more dangerous and more concerning inflammatory phase when the body's immune system gets activated and you get this inflammation. So when you veer into that inflammatory phase, you can go south very quickly.
Okay, in terms of going south very quickly, we know that steroids have been used in the treatment. What does that tell you?
The use of steroids is used in critically ill patients. So there are two reasons why they may use steroids in the president. Number one, they are giving him VIV treatment, and maybe they're giving him steroids out of sequence from which we would normally use it, which is in individuals who require oxygen and a lot of oxygen. The second reason why they may have used steroids in the president is that he's actually very sick, and they have not been very transparent in letting us know how sick he actually is.
What about the use of the experimental drug Regeneron? Do you think that's the right way forward at this point for the treatment from what you know about the president right now?
Yeah, so Regeneron is engineered antibody, and it's very similar to what we've heard of before in terms of convalescent plasma, except it's made in a lab. It's a elite antibody of the neutralizing antibodies. It was given early in his course, which was appropriate. The only problem is that there is not evidence as yet. There are currently randomized control trials. And in fact, Brian, if you or I were trying to get Regeneron, if we had COVID, it would be much more difficult outside of a trial. But the president was able to get it from a compassionate use through an individual authorization from the FDA.
Now, this appears to be, if the president is released today, a very short stay for this kind of an infection at this level, based on the evidence we're looking at. Just a 4-day stay if he's released today, Monday. Typically, though, hospitalization, the median length I'm reading, should be 10 to 13 days. Is that correct?
Yes, it's correct, but it's taken to average the well and the very, very sick people, so it's averaging about 10 or 11 days. But you're right, if President Trump were my patient, there is absolutely no way I would send him home tomorrow.
Doctor, thanks so much for coming in on this and for giving us your assessment of what has happened there. From San Francisco, Professor Peter Chin Hong at the University of California, San Francisco. Thanks very much.
Thanks so much, Brian.
What does this mean for the U.S. election cycle? Peter Roladal from our election team is here to talk about that. Good morning to you, Peter.
Good morning, Brian.
President Trump has, of course, been focusing very much on personal appearances. After what we just heard, is he going to need to change that strategy?
I don't know that he needs to change it. He's definitely shown no signs of wanting to change it. You know, Trump is very much someone who does not like to appear weak. He wants to, you know, project strength and as someone who's in command of every situation. And I think that this stunt, if you will, that we saw yesterday of him getting in the car to greet his supporters personally, it really shows that he will try to use this situation and this disease for his own political gain. I mean, keep in mind, the election is less than 30 days away, and it appears to very much be on the mind of Trump and you know, how can he use this to capitalize this coming out of the disease. And I think we got a preview of that message. We saw that, I think, in that soundbite where he says, you know, he's learned a lot about the virus by going to the real school, not, you know, just reading the textbooks.
But still, there's a concern. We didn't talk about that with Professor Chin Hong about possibly infected the people, his security staff, inside the vehicle he was in. That's a real possibility.
There was a lot of outrage. You know, we're looking at a car, the beast, the presidential car, that is not just bulletproof, it is hermetically sealed so as to prevent, you know, medical or chemical attacks. Means nothing comes in, nothing comes out. And, you know, really that showed that he's flouted health advice by getting into this car. And we saw a doctor from the Walter Reed Hospital tweeting this, saying, you know, every single person in the vehicle during that completely unnecessary presidential drive-by just now has to be quarantined for 14 days. They might get sick and they might die for political theater, commanded by Trump to put their lives at risk for theater. This is insanity. And still, the Trump campaign has come out saying that there will not be any additional safety protocols for upcoming rallies, for instance. We've seen a lot of his rallies, you know, where, again, most of the attendees and even the Trump campaign had more or less flouted health advice. There's been very little social distancing. A lot of these rallies have taken place indoors, and many have not worn masks. You might remember the rally in Tulsa in June. That turned out to be a super spreader event. So, you know, has Trump learned from this? It's hard to say.
What are his supporters saying?
Well, his supporters, not surprisingly, are still backing the president. We got a taste of that just yesterday. Here's some of the comments.
Of course, I was worried about our president. We love our president. I think he's in the best of hands. He's got his great doctors, and I think he'll be just fine. He's a strong, healthy man.
Certainly don't think the timing is good, but it sounds like he's recovering and getting through it well, so I don't think it'll have too much of an impact on the election.
I'm not saying that it was, you know, man-made. I'm not saying it wasn't, but it's kind of funny how everything's played out, you know, with all this.
I think he's a man of steel, so I know he's going to come out on top.
Well, does the Biden team think he's a man of steel? What's been their reaction? How are they trying, certainly at this time, to capitalize, take advantage of the president being hospitalized?
Well, Joe Biden's message from the get-go has been that he is someone who you know, a commander-in-chief who's also very empathetic. So they have gone out and said they're going to suspend negative ads. He's really used this moment to drive a message of unity, but also to say, you know, President Trump is enjoying a health care that is out of reach to millions of Americans. So he's really trying to drive that message of, you know, better health care for Americans. Polls suggest that that message could be working. His lead has widened. A recent poll in NBC showed him up 14 points. That is above the average, I might add, but definitely.
What's the average right now?
It's about eight points, which is very stable, but just to show that, you know, there does appear to be a certain bump. And very interesting, I find, was there was another poll out by Reuters saying that 9 in 10 Democrats and 5 in 10 registered Republicans agreed that if Trump had taken this virus more seriously from the get-go, he probably would not have been affected. So I think the conclusion here is there's definitely no sympathy bump for Trump.
Peter, thanks so much for coming in on this.